success being made right here. And then over a period of weeks or months, for them to be able to say, wow, I realize I don't need my layer one, we don't call it this, but I don't need my layer one or my layer two formula right now anymore. I don't need it. But I do feel like I'm still needing, this layer four formula is helping. Welcome to Community Campfire with Herbal Medics, where we talk about herbal medicine, health, wellness, and a variety of other topics. In today's videocast, we talk about integrating layers of medicine. Stick around, and we'll get right into it after a short message. I'd like to talk about layers of integrative health, or layers of approaching the concept of medicine and health from the standpoint of depth of layers. This is something that I've been thinking about for the last 2 or 3 years pretty intensely and applying it clinically and finding that the results have been phenomenal as I've done this. And so this is something I want to start to bring to the curriculum a little bit more in our clinical program especially, but to be able to look at medicine from this standpoint of superficial all the way down to deep. And this is using, in particular, the paradigms that I'm familiar with and that I have experience with. So going back about 35 years to Western herbalism and to Western allopathic medicine, all the way up to today, present day, where I'm really very involved in TCM, or traditional Chinese medicine. And even in that regard, I've been taking that and kind of changing it to fit my own paradigms of Western herbalism. So something sort of, along the lines maybe of what Peter Holmes has done with the energetics of Western herbs, but in my own way. And in doing so, and in looking at, this different model of how to integrate health, I have a lot of really amazing experiences with some of the most complex cases that I've ever had in my life. Or maybe I'd had cases that were complex in the past, but I didn't really know enough to really see the complexity and therefore be able to respond with what they needed. And so let me get into it here. So as you can see, I put this slide together for some visual on this level one, or layer 1 through layer 4. Working our way from Western herbalism through Western pharma-based medicine, so allopathic or osteopathic, or any of the offshoots of that, basically, in licensed healthcare practitioner type medicine in the United States. So there's a distinction to be made, obviously, between using herbs versus using pharmaceutical medicine, but there's not as much of a distinction as we might think when it comes to working with Western herbs from a Western perspective, or working with herbs from a Western perspective in our culture that we've grown up in the United States, where we have this sort of reductionist viewpoint of medicine that is not necessarily wrong, but it's not the whole picture by any stretch of the imagination. So what I've found is that, let me give some examples. If we're working with somebody who has maybe seasonal allergies, for instance, that we can certainly approach that from a Western allopathic pharmaceutical-based standpoint and say, okay, the either over-the-counter or prescription-based medication to be able to do things like dry up your postnasal drip and your sinuses, or to be able to help your body deal with the histamine response. We can do a very similar thing with herbs, and that's generally what we do in Western herbalism, is we look at the herbs from the standpoint of Western medicine. Now, when I first started into looking into and researching and working with Western herbs, it was very common in all the books that I read and the people that I talked to hear this phrase or something akin to, I want to get to the source of the problem. I don't want to just use pharmaceutical medicine. And while that's certainly understandable, and there are certainly merits to working with herbal medicine versus pharmaceutical medicine for certain concepts and certain things that are going on in our body, it's not really working with herbal medicine as a substitution for pharmaceutical medicine isn't really getting to the source of the problem usually. Now, that said, there are certainly times where pharmaceutical medicine is appropriate, right? Where we just have massive infection or we just have massive inflammation. We just have to turn off things that are going on in our body, no matter what, in order for our body to be able to recuperate and to get over that and be able to heal itself the way it does, right? And with herbs, we generally can do that also from a medical herbalism perspective, from a Western perspective, by working with an herb, for instance, for something like like seasonal allergies that are leukotriene inhibitors, for instance, like butterbur, right, or something like that, or something that's going to help dry up the sinuses and the inflammation, like goldenrod. We can do that, and that's fine. There's nothing wrong with approaching herbalism from that perspective. And having competence in doing that is a great way to start with working with people and to build people's confidence in working with herbs who are, or taking herbs, that you may be helping them with. And you want that, right? I mean, at the end of the day, you want them to come back and to be able to follow up and be able to help somebody. And you can never do that with just one clinical visit, no matter what it is usually. Or if you can, you're not going far enough and deep enough to where they're not going to need to come back for more herbs, basically, to continue to do the same thing. And here again, we have that Western pharmaceutical approach. It's like, well, yeah, just keep taking. I've been taking this particular drug for 10 years. My blood pressure medication for 10 years, and doc says it's good to go. I just keep taking it. That is absolutely the opposite end of the spectrum from actually working towards dealing with and addressing the source of the problem. Okay, so let's run through this and talk a little bit more about it with the examples, since that's probably the best way to do it. We talk about allergies, or another good one is like insomnia. I think that gives us a real clear picture. So somebody is dealing with, well, let's just continue the allergies. I'll come back and I'll go through insomnia too. How about that? So allergies. So I just already talked about kind of layer one, right? In terms of what we're doing with Western symptomatic approach, whether we're using pharmaceutical medicine or we're using herbs. The difference really is that herbs having thousands, tens of thousands maybe of constituents, and the way that they work with our body, and our body knowing what to do with plant food and plant medicine, the outcome is usually very gentle. And while it may do exactly what we want, we usually don't have a lot of side effects. Whereas we're working with pharmaceutical compounds, our bodies don't really know what to do with those, and they will affect us. They'll affect every cell in our body. Oftentimes, in some way or another, we'll have side effects, even whether we know that or not. We may not even recognize them as side effects, or we may not be sensitive to them as side effects, or we may be very sensitive to them. So there's a difference there, but there's not really a difference in the actual approach and the mindset in getting there, if that makes sense. How about functional medicine then? For allergies, what are we doing with allergies for functional medicine? Well, there's a lot of things that we would start to approach. And we start to look at gut health, and we start to look at, what is functional medicine, first of all? Well, we're talking about the medicine that, is generally coming from an allopathic standpoint. Well, it's an outgrowth of allopathy and folks that are MDs and DOs saying this is not, pharmaceutical medicine is not the answer for everything. We need to look deeper in this. And so it's a wonderful thing. Functional medicine is an amazingly wonderful thing that looks at our health from maybe a cellular perspective, or an organ system perspective, in terms of the functionality of the of the health, of the cellular health that's going on there, and how to help stimulate or support that health in order for the body to be able to heal itself. So it's really very much akin to Western herbalism in many ways, with the exception that there may be more of a traditional allopathic reductionism going on in terms of looking at tests, looking at blood work, looking at liver enzymes, whatever, and then applying maybe the use of a lot of more derived substances, such as such as nutraceuticals, right? So supplements, and or plant extracts, maybe standardized extracts of a specific constituent, maybe berberine, for instance, or whatever. So as we're doing that from a functional medicine perspective, it's kind of like this bridge between the two worlds, in some ways, between the worlds of Western medicine and Western allopathic medicine and Western herbal medicine. It could be seen as that. Also looking more for causative effects. But it's still, usually the causation of disease from a functional medicine perspective oftentimes boils down to digestive health, to the gut, to leaky gut, to things that are going on in the gut. looking at evidence, continued evidence from research that shows that there is a intrinsic connection between the nervous system and the gut and the brain, and that all the things that happen to be able to say, hey, this is what we're looking at, or these are the types of lymphocytes that we want to stimulate, and these aren't the types that we want to. So it's very reductionist in its approach, and even though it's more of a causation type approach, hey, are you just basically overwhelming your body with toxins or bad food, and if so, let's change that first. Let's change that. Are you living in a house where you're exposed to mold all the time? At least looking at those causative effects and changing them, which is very important, right? That is going to the cause of disease. But it still is a kind of Western allopathic approach in a lot of ways. What I mean by that is that it's still saying, in the end, we have to turn off or shut down, channels of some sort, or change something in the body, generally without really knowing for sure what is going on in the imbalance. So I like to think of it as we go from layer 1 to layer 4 here in this picture, that we go from snapshots, like still snapshots of body health in layer 1, like one snapshot, and layer 2, which I didn't really talk about. I'll talk about that in a second. Also being more of a snapshot, but maybe a few snapshots. And layer 3, maybe 3 or 4 snapshots. To layer 4 being a moving picture, right? Constantly a picture of constant movement that we are moving, that we are affecting, and that effect, however we affect it, will affect the movement from there forward, and we affect it again, and it continues to affect it. So it's like going from one picture to a moving picture, right? To a video or to a movie. Layer 2, I skipped over. I apologize. What we're talking about there is the concept of TCM again, traditional Chinese medicine, the branch of the disease. So TCM has its own sort of interesting way of breaking down disease off of the root to the branch, where it says, hey, there's a mechanism going on here that is not really at the cause of it, and we know that, that's the difference, is we know that's not the cause, but we need to affect the branch first before we can really get to the cause, or affecting the cause is going to take us months, maybe even years, whereas affecting the branch, let's go ahead and do that now because it might be faster, or there's other reasons we would do that. Okay, so then layer 4 is the concept of syndrome differentiation from a TCM perspective, where we're looking for, and I hate to use the term energetic, but energetic can mean so many different things. It's not really accurate, in my opinion, as a word, but there isn't really a word to describe what's going on when we're looking for an imbalance in that moving picture that I was talking about, or that video of life in the body. What we're doing there is we're looking for imbalances that may be there. Okay, so back to the allergy thing. So if we went layer 1, so antihistamine and that type of an approach, whether it's allopathic or whether it's herbal. Layer 2, similar from an herbal perspective, but instead of it being just the reductionist idea of an antihistamine, it might be something that is going to deal with the underlying mechanism to some extent, right? Maybe phlegm, for instance, but the phlegm that's being caused, and phlegm from a TCM perspective is a little different than phlegm from a Western perspective, but it's also similar. There are similarities. You can have a phlegm that is very much the same phlegm that we talk about with the lung phlegm, or with respiratory phlegm too. So let's say we have phlegm, too much phlegm, that we can deal with that as a branch and say, okay, let's cut back, let's deal with the phlegm, but the phlegm may have other causative issues going on with it that you could deal with as well, as opposed to just saying from a Western perspective, let's just inhibit histamine response, period, boom. But then we get into Western functional medicine where we might start to say, hey, you've had allergies your whole life. Maybe you have asthma, maybe you have eczema, whatever. And so we've got some sort of an autoimmune or autoallergic issue going on here. Let's look at what some of the causative effects might be. Let's look at the gut, for instance, and the diet and so forth, which is usually where everything starts to channel down to, or at least be a big part of. Layer 4, TCM syndrome differentiation, we might say, okay, look, yeah, you have phlegm, but that's from too much damp that's being caused by any of these other aspects that might be there. So there's moving parts. The moving parts might be chi related. They might be blood related. They might be phlegm related. They might be, organ system and organ related. So liver and how the liver works, or the spleen and how the spleen works in TCM, how the stomach works, how the large intestine works, and so forth. And so as we start to ask these questions, we'll start to, differentiate where is the actual source of this problem coming from. There might be 2 or 3 things going on here, but which is the one that really is underlying everything? Let's run through insomnia the same way, and maybe as I go through each of the examples, it's a little bit simpler. So layer 1, insomnia. What are we going to do with it? Well, let's prescribe from an allopathic pharmaceutical perspective. Let's sleeping pill, some form of a pharmaceutical that will help you sleep. Right? Western herbalism, very similar, right? We're going to say soporifics, right? So some of the different soporific herbs that are going to help you sleep, or anxiolytics, or herbs that, some form of nervine. So nervines do a number of different things, right? They can be for irritability, they can be for anxiety, they can be for insomnia, they can be for pain, whatever. But there's a lot of overlap between many of them, and a good formula will do that. Like we have a formula. I do this myself, right? Let's just help somebody deal with the sleep and getting to sleep. We have a formula called Rip Van Winkle in our store, in herbalfirstaidgear.com. And so it's a really good formula. It helps people a lot, right? Functional medicine, we start to look at, okay, maybe there's some nutritional issues, right? Maybe magnesium or melatonin, or where does cortisol fit into this in your different patterns of cortisol throughout throughout your day. And starting to look there and looking for maybe supplements to be able to be able to help after looking at blood work and that type of thing. TCM syndrome differentiation will say, okay, look, that we're going to start asking questions that wouldn't have any meaning on any of the other 3 layers, really. Okay, what I mean by that is when we're working with something like insomnia, is I want to know so many other things. I want to know, do you wake up, do you have any problem falling asleep, first of all? Okay, you can't fall asleep, or you can fall asleep fine, but you wake up at the same time every morning, at 2:30 or 3 in the morning, whatever. What time is that you wake up? When you wake up, are you hot or are you cold? If you're just, or is it just that you're kind of cold but your extremities are hot? Do you wake up with anxiety? Do you wake up irritable? Do you, when you wake up? When you're trying to go back to sleep, is your mind really busy? Do you have nightmares a lot? What is it that you in general would say that you are? Are you generally kind of a hot person or a cold person, or neutral, throughout the day? You have a hard time staying warm, or do you have a hard time, always too hot? Continue. What is your, what's your level of irritability? What about your digestive? What's going on with your digestion? And here, not really from a functional medicine perspective, but I want to know, the regularity of BMs, and more to the, tendency to loose stools, or more to tendency to constipation. How regular are you? Do you have any issues after you eat that would be things like bloating or GERD or anything like that are going on? Pain there. So we can continue to ask these questions that might seem like they are, there's definitely some overlap, especially into functional medicine, a little bit into TCM root branch, but not really so much into layer 1 at all, right? I mean, if you're just giving somebody something to help them sleep, it's going to be rare that a doctor who's doing that is really going to care that you're waking up with nightmares, or that you have anxiety, or that, maybe. I mean, if there's a psychiatrist or a psychiatric issue going on here with somebody who has a lifetime of anxiety issues, that may be a different story. But in general, if you just go to the doctor and say, hey man, I'm having a hard time, and just starting this year, I've had a really hard time falling asleep, and I have these nightmares. They would look at the whole thing with nightmares or with, I wake up and I'm always in a kind of a sweat. It's rare that you would find a doctor that would find that information useful at all. Right. And why? Because they're not working with the same tools that can work with that anyway. Right. So every system has its own tools. And in the case of pharmaceutical medicine, it's pharmaceuticals. And the pharmaceuticals don't care, about that. There's not a differentiation between those things. And the reason there's not is because it's a very isolated, separated, compartmentalized viewpoint of how the body, the mind, the spirit, and all of that works. And a layer 4, for me, what that is that it's all very much together. It's instead of being compartmentalized back to the moving picture versus snapshots, it's all working together. And so wherever we enter into that moving picture and we start to make a change, we know it's going to make a change in the whole moving picture from there forward. And so we're ready for that. And when that happens, we're going to make another change. We're going to have to constantly reevaluate and change. And hopefully, as things improve, we're going to make some other tweaks and we're going to change things and we're going to work ourselves out of a job, ideally, as a clinician, is at some point, their body is going to be back in balance in that way. And that's not saying that everything is going to be, perfect forever, but it's going to be in balance in that way, and they're going to stop having those symptoms. Now, they might have some other symptoms in the 3 or 4 months or something else happening that's another out of balance issue or whatever. This has been really, really phenomenal for me in working with things like endocrine disorder stuff, or, so if we're working with, and especially like perimenopausal is a huge one. It's an epidemic in this country where we've got blood sugar and weight gain issues and cortisol issues and the thyroid sometimes issues. Hashimoto's starts to suddenly raise its ugly head, and we've got hypothyroiditis going on in there. And so as we get into that, there's just no way feasibly, and I've been there, it's not really feasible to be able to work with this from a Western herbalism, like a medical herbalism perspective. It's just plain whack-a-mole. You go after one thing and then something else pops up. You have to be able to see the whole picture much better. And so my goal is, out of this is to be able to translate all of this and put it into working, curriculum that's going to really help students. And so it's pulling in, aspects of TCM. It's pulling in aspects of energetic medicine in that regard, but not in a way that, means you have to learn a whole bunch of stuff that's like very kind of esoteric or different, but really to make sense. And as always, I like to work with curriculum that's very pragmatic and practical in its application. And we can see how, yes, this is something you should consider. Maybe you've never considered this before. Let's start, doing this and entering in when we have this particular set of symptoms here. Let's try this approach that's more of an approach around something like spleen-yan deficiency, because there's a lot of symptoms that say that's what this might be. And as you start to do that and work with that, you notice that you can mix in these, into your formulas. You can start working with that, and you can even have separate formulas. Sometimes you'll have one that's more Western, and I oftentimes do that. I'll have one that's a little more Western and one that's a little more TCM. And not purely, not like 100% purity in each side, but a little bit in each, more in one direction or the other. And one that might be more like a layer 1 or a layer 2 type of an approach. And then one that's more of a layer 4 approach for me. I don't really work with supplements much. And so functional medicine, even though I'm very familiar with it, and especially if they're working with Kyla, I certainly work with it, but it's not really my approach per se. So it's more for me, what can we do that's a level 4 approach that we can start to, or layer 4 approach that we can start to integrate into all of the other things that we're doing, level 1 and level 2 here, to be able to slowly get rid of, the initial symptomology that we're following that's very, problematic, and at least to be able to have the person feel like, yeah, there's some success being made right here. And then over a period of weeks or months, for them to be able to say, wow, I realize I don't need my layer 1. We don't call it this, but I don't need my layer 1 or my layer 2 formula right now anymore. I don't need it. But I do, I do feel like I'm still needing, this layer 4 formula is helping. So, and that's very oversimplified, by using those terms. But that's how my mind works on this right now, and I wanted to share that because I think it's really got a lot of there are a lot of things coming off of this that are going to extend into curriculum in the future, and it certainly have helped me immensely as a clinician over the last 2 or 3 years, to where I've been working with some very complicated cases that I've just been blown away by how successful this approach has been for me. Just, like things that I never would have been able to have this kind of success with. Might have had short-term success in the past, but this is long-term success over and over again. So I think it's a really powerful way to start looking at medicine, at herbal medicine in particular.